Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about heparin induced thrombocytopenia. Heparin induced thrombocytopenia can be divided into two types, type 1 and type 2. Type 1 is actually non-immune mediated, whereas type 2 is immune mediated. So in non-immune mediated, it is mild, and here heparin is continued. Okay, in immune mediated, here there are formation of antibodies against the platelets. Because of these antibodies, there will be formation of paradoxical thrombosis will occur. So if there is paradoxical thrombosis, then heparin should be discontinued immediately. It should be discontinued, and in this the anticoagulant of choice, if you see, anticoagulant of choice is, you should give lepidolin is the anticoagulant of choice. Thank you for watching.
Thank you and thank you for watching.